Hi, my name is Jessica Coletta, and today we'll be doing a sterile dressing change for my re-critique. So ideally I would have liked to have had a bed and a proper patient and a bedside table in order to do the triangle to make it sterile, but I was unable to do that, so I have set up in my dining room table and I'm working to the best of my ability. Please note that this is my second time filming this. The first time that I did film this, I was almost done and my cat walked across the table and knocked over my bottle of saline and absolutely destroyed my drape. So I have all of my stuff already opened, but for the sake of the critique, I will pretend that it is sterile. So I'm just gonna get started. The first thing I'm gonna do is check the doctor's order. So I have the chart right here. My patient's name is Sid Garland. His birthday is November 8th, 1965. He's allergic to codeine and penicillin. The doctor's orders are to clean the wound with normal saline, apply a simple dressing to the wound, and change the dressing every 3 days. That's exactly what we're gonna do. Once I've done that, I'm gonna wash my hands and gather my proper supplies. So I have some hand sanitizer right here. Wash my hands. And get my supplies. So today we are using a pair of clean gloves. I'm using two 2x2 gauze. Usually I would use 4x4, but I don't have any in my lab kit, so we're using 2x2. A roll of tape and a pair of sterile gloves, a 5x9 abdominal pad, my normal saline, and a sterile dressing tray. Once I've done all that, I'm going to make sure I've properly identified my patient. So I already know on my chart that it says that my patient is Sid Garland, his allergies, and his birthday, but I'm still going to confirm that with him. So I'm going to ask him his name, his date of birth, and his allergies, and I'm going to check his wristband to see his name, date of birth, and allergies. I'm also checking the identifier number on all three of those. Once I've done that, I know for sure that that is my patient and that I'm performing the right procedure on the right patient, which is super, super important. Once I've done that, I'm going to introduce myself. So I would say that my name is Jessica Coletta. I'm a first-year nursing student at Durham College, and I would obtain consent and explain the procedure. So I would just say that I was doing the wound cleaning. Is that okay? In my case, the patient has said yes. Once I've done that, I'm going to prepare the client. So I'm going to ask if they need to use the bathroom or if they're in any pain. I would assess the pain by using the pain scale. So it's area pain from 1 to 10, 10 being the worst. If they need to use the bathroom, I'd ask if they need assistance. In my case, again, my patient is fine. So I'm going to do an environmental check. I'm going to make sure that my patient is in the lowest position with all 4 bed breaks on, that the 2 side rails are up, that his call bell is in reach, and that the curtains are drawn and the room is clutter-free. Once all that's done, I'm then going to start. So I'm going to bring my patient up to working height, and I'm going to start opening my sterile tray. So your first flap's going to go away from you. Second one. Third. There is a pair of forceps in here, but we're not using it to move them around. You're using it to set up your sterile field. So I have a garbage bag in it, and most of them do come with these. I'm going to ask the patient if I can put it on the side of his bed. He said yes, so I'm going to put that there. I am then going to open everything. So all of your gauze and like abdominal pads, those are going to come like sealed. So you're going to banana peel it open and pull it out with the forceps. And this can go in the garbage. Can't reach it. You're always carefully maintaining that 1-inch border. Okay, so once you've done that, your tray is set up. I have my gauze on there, my forceps where I want them to be, and my abdominal pad. These have come in contact with your paper, so they are considered contaminated. Those will go in the garbage. You won't use them again. I have my garbage here. It is considered dirty, so I don't need to worry about keeping sterile. I'm going to set it up, put it on the end of my bed, and then wash my hands. Okay, wash my hands. The next thing I'm going to do is pour my solution. So the doctor ordered normal saline, so that's what we have here. I'm going to make sure on the label that it is the right one. I'm also going to check the date and make sure it's not expired. It is not expired right now. I'm then going to lip the solution. If you lift the solution, it just means that a little bit of it's going to come out and that you know it's all clean. And then I'm going to pour it onto my tray. And that's all done. Once I've done that, I'm going to put some clean gloves on and assess the wound. Okay, so looking at the wound here, here's my patient. I lift it up and the wound is intact. His sutures are good. They're not loose or undone. There's none missing. There's no odor or excess redness. There's also, it's not looking like hot or anything. For the excudent, it's a reddish pink, so it would be considered serous sanguis. So the wound is looking good and it looks like it's healing properly. So I'm just going to dispose of this. Get rid of these. And wash my hands. Okay, hands are clean. And then I'm going to apply my sterile gloves. I've asked my patient if I could put them on his bed. He has said yes. So just like setting up your sterile field, you want to maintain that 1-inch border. I'm sure that doesn't happen. Okay. So your first one's going to go in. One cuff. And I'm now sterile. To get rid of this, because you are maintaining that 1-inch border, you're not going to want to reach it up by the ends. You're going to want to pinch in the middle and dispose in the garbage. So I'm now sterile. I'm able to move around and touch anything on my tray. And I'm going to use the hand closest to the wound so that I'm never reaching over the sterile field. So the first thing I'm going to do is take my forceps. Dip it into the solution and squeeze it out so that it almost looks like a rosebud. And you clean top to bottom on a wound. So you go medial, discard, again, like I said, you make it like a rosebud. Then you go distal, top to bottom, discard. And then proximal and discard. These have been in the wound, so they are considered contaminated. You're not going to need them again. They're going to go in the garbage. Taking these forceps, you're then going to place your gauze. So again, like I said, I would have liked to use the 4x4 because they are larger, but I only have 2x2, so that's what we're using. Now I'm going to place the abdominal pad. And the abdominal pad is on. Once the abdominal pad is on, you don't really have to worry about sterility anymore because everything underneath that is covered. So I will be covering the wound with tape now. You don't have to keep it, like I said, you don't have to keep your sterile gloves on for this, but I am going to anyways. Before I tape the wound, what I should have done was assess the wound after I'd cleaned it. So after I cleaned it, it was looking fine. It's all good. And when I say it's all good, I mean that there was no sutures coming out, there was no excess bleeding, so that's how you know the wound has been properly cleaned and it's in good shape. Wow. Stuck on my glove. And you're just going to properly tape it all. You want it to be properly secured so that nothing's falling out. And one last, I'm doing 3 to hold it, which is probably the best for it. Okay, And just like that, my wound is now covered and cleaned, and it is looking good. So I can get rid of these. Okay, so that is properly secured. I'm going to ask my patient if they need anything, if they're in any pain, make sure that their call bell is in reach and that they are in the lowest position with all the brakes on. And as for that, my patient is good. After that, I will probably dispose of everything. So any of the drapes or anything that came in contact with bodily fluid will go in biohazard, and anything like forceps, anything sharp will go into the sharps container. After that, so I've properly disposed, I'm going to wash my hands, and I am done.